lot of the important steps, regulation being one of them, partnering with carriers. You know, you've accomplished quite a bit in the last 12 months, so I'd love to hear more about it.
Absolutely. Thanks, Brian. Thanks for that, for the comments. So as Brian said, I'm a little bit of a wireless junkie, is the honest truth. And back in 2002, I developed type 2 diabetes myself, so I affectionately joke with people that the two things that define my DNA, one is good, wireless in my blood, one is bad, is too much sugar in my blood, but here we are at WellDoc and the two have fused. The company was actually created, it was a brainchild of an endocrinologist at the Joslin Center, University of Maryland, arguably in one of the finest institutions worldwide, where you had all of the care at your fingertips. You had the nutritionists, the educators, cardiologists, et cetera. She found she couldn't make a difference in outcomes. It was as though a patient would come in, see maybe 3-4 times a year for a couple of minutes, and you know, your blood sugar's never as good as the day you see your doctor, right? For you, it's 108. It's like flossing the day before you see your dentist. And when you think about it, there's a number of reasons why people aren't doing the things that their doctor's telling them to do. And it's not, there's no blame game here. There's no blame game to the patient. It's a complex disease. You got to manage your meds, your stress, your diet, your exercise, your smoking, sleep, all the 360 that affects diabetes. And there's this little thing called life that tends to get in the way every now and then. At the same time, I consider myself a little bit of a nerd. I graph my stuff and I take it into my doctor. Well, now I have my WellDoc solution that actually graphs it for me. But what's the doctor going to do in a 2-minute office visit? The human eye can't do that kind of pattern recognition. So they say, oh, yeah, it looks like you're doing good. Meanwhile, I'm swinging like this all day long, and they see an average in my A1C and say, oh, come back and see me in 3 months, right? Blind coma, blind coma, blind coma. You know, like this thing is going to break. So we said, listen, the former speaker from Panasonic, I think, had it right. Data, information, knowledge, wisdom. I'd assert that there's a last one called action that closes the loop. If you can actually take, so when I poke my finger before lunch and it says, you know, 168 mg per deciliter, what do? I always use the analogy of traffic. When you're driving on the freeway and you turn on the radio and it says, oh, this ramp is closed and there's a traffic jam here, there's an accident here, you just want to know how to get home. It's the same for me. Okay, it's 168. What should I do? Should I eat? Should I not? If I should, what should I eat? How much should I eat? Should I take my meds? So you need to take the data, of course you need to translate it into information knowledge, but not just for the patient. You need to provide some evidence-based medicine analysis that suggests to the provider, hey, here's where they were 3 months ago, here's where they are today, this is what's changed, this is what evidence-based medicine suggests you may want to discuss with them, but you're the expert, do what you think is right for your patient. And I think when we built this system that was part virtual coach for the patient, part clinical decision support for the provider, but then this longitudinal kind of pattern recognition system that connects the two. Why is it that this patient is continually taking their Byetta? Byetta only works when you eat. So patients taking their Byetta at breakfast, because their doctor says take it at breakfast, but they indicate in the system they don't eat breakfast. It's a wasted shot. And the system is like, hey, did you know after n equals 3 observations, did you know that Byetta you have to eat? Talk to your doctor about maybe switching your dose to when you eat. And the doctor's like, I told him to take it at breakfast. I meant with breakfast. You know, patient-physician discordance. And so what we're really seeing at WellDoc is, can you take this clinical approach, leverage it and marry it with the technology that everybody has at their fingertips. The cell phone is an amazing thing because it knows no socioeconomic boundaries. It knows no literacy boundaries. It knows no language boundaries. It's everywhere. Everybody has a cell phone. And can you take this and enable the numerator, improved health outcomes, which we'll talk about later, the denominator, reduced healthcare costs, but can you do it within the confines of the regulatory environment? So a lot of people are like, how do I get around the FDA? You actually don't have to. You can innovate within what the FDA is, kind of put their sandpins. And then you start to look at our friends on the left. I mean, these people are the people that bring access to this, whether it's a network access or a platform access or a specialized device access. When you marry all of this together, that's how you affect patient behavior change. That's how you actually improve outcomes. That's how you reduce costs. That's how we're going to transform the $3 trillion problem we have today.
Yeah, I think on that point of the FDA potentially being an asset to some companies is, I mean, it didn't pass me by how quickly AT&T signed up with WellDoc after you announced your FDA approval. So clearly it's important for getting these partners on board also. Our next panelist to Anand's left is David Inns, who is the president and CEO of GreatCall. So GreatCall, you probably know them through their Jitterbug wireless service, and they have others as well in the pipeline. David also serves on the GreatCall board of directors. He designed the service and launch plan for Jitterbug, which began selling in November 2006. and the brand itself has now become a national brand associated with an end-to-end experience designed specifically for simplicity seekers. So David, I would say Jitterbug's been one of the leaders in terms of service providers for health services for the consumers. You've really pioneered the direct-to-consumer model in mobile health, so I'd love to hear more about that in the next couple of minutes and really maybe some of your future plans also.
Sure. Yeah, GreatCall. Really what our goal is to focus on keeping customers connected, safe, and healthy. That's our mantra that we follow. So not only do we focus on creating simple, easy-to-use devices, but also on creating simple and easy-to-use mHealth applications, whether it's working with a partner and taking their applications to market direct to consumer, like WellDoc, or in some cases with our own applications. For example, today we just announced our 5-star personal security service, which is basically an emergency response service for through your phone. So at any point in time, if anything happens, you can call. You just hit 5-star on your phone, and you get through to emergency operator, who can conference call in friends and family. They can dispatch 911. They know who you are. They know exactly where you are using location-based service. They have all your medical background. So we continue to try to just think about how to keep customers safe and healthy using the engagement of the cell phone. And that's where I think we're really passionate, and where it's a little bit different than some of the other focuses. What we really are trying to do is think about consumer interaction and driving behavior change. And that doesn't necessarily mean that we can go out and get 100% of our customers to start following health advice through their cell phone. But our goal is by saying, if we can do something simple like our wellness call, or providing some wellness coaching and some techniques for reducing stress, and 10% of our customers actually engage in that application and start taking some value from it, well then that's 10% of people that are now better off. Can I measure that and take it to the FDA? Probably not, but I think what we're doing is we're having an impact on those people. One of the things about behavior change, I read this great blog, and I can never remember who it was, so maybe somebody can remember, but they were comparing how we're going to have to get health management and consumer engagement to be almost like the people that drive Priuses. How many people drive Priuses here now? It's a lot. I hear there's this, I don't have one myself, but I hear there's this thing that Prius drivers do where they have this game they play with themselves, where they try to see how good they can get the miles per gallon thing, and they do all these things of like really trying to, oh, I hit a new record. I just got the miles per gallon to X. And so there's this game, and if we can get people to think about their health that way, give them the tools and give them the measurements to actually engage on a daily basis, to be saying, I'm engaged, I'm thinking about it, and wow, look at that, I'm actually making an impact, and I'm trying to move the needle like in a video game, that's going to be the holy grail where we can really start making an impact.
Great, thanks, David. And to David's left is David Haight, who is the Vice President, Business Development, Emerging Devices at AT&T Mobility. In his role, David leads a team focused on proactively targeting, identifying, and managing strategic partners in many industries, including personal computers, consumer electronic internet devices, in-car entertainment, navigation systems, cameras, healthcare monitoring, personal tracking, machine-to-machine, and more. Previously, Haight was responsible for national distribution business development with AT&T Mobility and Wired Products. Again, David, I think the last year was a big one for AT&T. A lot of big partnerships, WellDoc being one of them, just announced MedApps. Clearly, announcing your new 4Health business unit was a big milestone for this industry, so I'd love to hear more about it.
Yeah, thanks, Brian. We have a very extensive and comprehensive approach to the mHealth space. And obviously, as big as we are, we have the opportunity to do that, to be involved in the entire ecosystem, if you will. So obviously, a good portion of our organization, in combination with our relationship with WellDoc, is focused on information management and through platform storage and so forth. And then that's obviously an important element to this. The area that I focus on is really what we call the upfront piece, and that's the ability to gather data, or one of the ways in which data is gathered that then gets plugged back into the rest of the ecosystem, and how that information is managed through all, obviously, the stakeholders and caretakers and so forth. So our focus from a